4 worst vitamins to avoid and 4 must take daily. For years, people over 60 have been advised that taking vitamins in the morning is one of the healthiest things they can do. A tablet for your bones, heart, and possibly energy. Simple, right? This is the terrible fact most seniors never hear. Some vitamins you use daily may make you weaker, foggier, and sicker. Clinical studies show that certain supplements touted as senior must-haves can build up in your body, straining your liver, hardening your arteries, and potentially increasing your risk of stroke or neurological damage. The kicker: not unique or strange drugs. Most seniors' medical cabinets contain these daily vitamins. Why? Because aging changes our bodies. The liver filters poisons less well. Kidneys can't filter extra anymore. Blood vessels and nerves weaken. Thus, what was healthy at 40 can become a quiet health trap by 65. In this video, we reveal the 4 vitamins you should never take after 60. The 4 vitamins you should take every day to protect your brain, develop your muscles, and lengthen your life are equally crucial. You'll want to remain till the end. Vitamin 1 reduces all-cause mortality by 36%. That's not hype, hard data. So get your supplements, check labels. Let's see if your morning medicines are helping you live longer or harming you. 4th worst vitamin, vitamin A, retinol. After 60, the decent guy becomes poisonous. Vitamin A may seem heroic. It benefits your eyes, skin, and immune system, say doctors. In the correct shape and amount, yes. This is what most seniors don't realize. After 60, too much synthetic vitamin A, retinol in multivitamins, and liver-based supplements can quietly build up and become deadly. A is fat-soluble, unlike C and B, which are water-soluble. That implies your liver and fatty tissues store it. As you age, your liver slows, making it less efficient at processing excess. Vitamin storage changes with fat distribution. You'll still have vitamin A tomorrow. It slowly drips into a cup till it overflows. Secret risks. Years of buildup might trigger symptoms elderly mistake for aging. Dry skin, fragile hair, dizziness and blurry eyesight. Stiffness and joint pain, constant tiredness. But there's more. In 2022, the European Journal of Clinical Nutrition showed that seniors with extra vitamin A had a 25% greater incidence of atrial fibrillation, an irregular pulse that greatly increases stroke risk after 65. Thus, a simple vitamin pill may quietly increase your risk of a life-threatening occurrence. How much is excessive? Any multivitamin or supplement with more than 700 mcg of retinol or retinol-palmitate per day for women or 900 for men is dangerous. Many senior supplements overshoot without your knowledge. A safe alternative. Some excellent news. Not everyone must give up vitamin A. Your body needs it. Beta-carotene is safe, naturally found in eggs, carrots, spinach, and sweet potatoes. The body only converts it to vitamin A when needed. That eliminates overdose risk. Consider beta-carotene a self-regulating gasoline tank. Fills only when your body is low. Retinol fills the tank till it leaks and causes harm. Bottom line, check your supplement label today if you're over 60. If you see retinol or retinol-palmitate, reconsider. Replace it with actual food and let your body decide how much. After 60, keeping healthy doesn't mean taking more drugs, choosing the correct ones in the right form. Worst vitamin number 3, iron supplements, energy enhancer that fails after 60. Most people associate iron with energy. Doctors recommend it for weariness. Multiple vitamins add it for fatigue. Iron has been sold to treat brittle nails, pale skin, and frailty for decades. No one tells seniors this. Iron supplementation can slowly poison after 60. Iron resists flushing, unlike water-soluble vitamins. Instead, your liver, heart, and pancreas store it. Adding iron to your body doesn't deplete it over time. Like old pipe rust, it slowly corrodes from the inside out. Why aging iron is harmful. Iron loss stops at adolescence for men and menopause for women. This eliminates the natural iron outflow. You're probably not deficient unless you've had surgery, ulcers, or a disease-related blood loss. Extra iron in organs causes oxidative stress, where unstable chemicals destroy cells and prematurely age tissues. Alzheimer's research and therapy found that extra iron increases dementia risk in 2018. Other studies links it to heart disease, liver damage, and cancer. The kicker: iron supplements are rarely needed by elderly. The quiet signs of iron excess. The scariest part? Iron poisoning is silent. The symptoms are ambiguous and easily mistaken for aging. Stiffness and joint pain, unrelieving chronic fatigue, brain fog or memory loss, palpitations, irregular heartbeats. Hiddenly, that energy medication may damage your heart, liver, and brain. Why multivitamins hurt. Many popular senior multivitamins contain iron, even though most older persons don't require it. That, plus iron-rich foods like red meat, beans, and fortified cereals, fuels the fire. To do instead? This method is smarter. Check labels. If your multivitamin contains iron and your doctor hasn't found a deficit, switch. Be tested. Request a serum ferritin or transferrin saturation test from your doctor. This tells if your iron is too high. Select iron-free senior multivitamins that prevent overload. Keep your diet balanced. Lean meats, legumes, and leafy greens provide enough iron without supplements. Bottom line: young people who lose blood need iron. After 60, your body doesn't need more. It can gently hasten aging, decrease memory, and strain the heart. Before taking another energy-boosting drug, remember that what was helpful can become dangerous if your body no longer needs it. You don't get energy from iron pills after 60. It comes from organ protection, inflammation reduction, and providing your body what it needs. Worst vitamin number 2, calcium supplements, the heart-damaging bone saver. Seniors have been told one thing for decades: take calcium daily for strong bones. It appears in TV ads, doctor brochures, and most bone health multivitamins. Here's the frightening reality. Over 60, calcium supplementation, especially alone, can be harmful. Problems with calcium supplementation. Young bones absorb calcium like sponges. Your body receives instructions from hormones and growth factors. That system slows after 60. Bones stop absorbing calcium well, and that extra calcium you're consuming, it persists. It goes wrong. In your arteries, hardening them and increasing heart attack risk. In your joints, causing stiffness and pain. Your body tries to reverse calcification in your soft tissues. In 2016, the American Heart Association Journal reaffirmed the risk. Seniors who used calcium supplements had 22% more heart disease. Instead of strengthening your bones, you may be weakening your heart. The quiet signs of calcium excess. Signs initially appear harmless: bloating and constipation, achy joints, low energy and focus. Calcium excess can eventually mean calcified arteries increase stroke and heart attack risk, renal stones uncomfortable and recurrent, reduced zinc, iron, and magnesium absorption, and terrible irony: your bones may not strengthen. Why does calcium alone fail? Not many supplement businesses reveal this secret. Calcium needs partners to function. Your intestines absorbs calcium into your bloodstream with vitamin D3. Vitamin K2 maintains calcium in bones and out of arteries. Magnesium balances calcium to prevent tissue hardening. Your body has no direction when taking a calcium pill, so it puts the mineral in the wrong area. What to do instead? Look for food. Leafy greens, bone-in sardines, yogurt, almonds, and chia seeds contain natural absorbable calcium. Pair with D3 and K2. If you must supplement, take calcium with these vitamins. Move around. Weight-bearing activity strengthens bones as well as calcium. Check your intake. If your multivitamin is 500 to 1,000 mg daily and you eat calcium-rich meals, you may be overdoing it. Bottom line: calcium is important, but not as seniors are told. Calcium pills alone can block arteries, stiffen joints, and increase heart disease risk. Real bone health requires balance. staying active, eating healthy foods with calcium, D3, K2, and magnesium. It's not about taking extra tablets beyond 60, making sure nutrients go where they belong, to your bones, not arteries. Worst vitamin number 1, vitamin B6 high dose, energy booster that softly harms nerves. Most individuals think vitamin B6 is harmless, water-soluble, it boosts energy, supports nerves. What's wrong? The frightening truth. High B6 doses can harm your neural system after 60. Why is B6 hazardous after 60? Most B vitamins are easily flushed away, but B6 is different. High dosages collect in nerve tissue. This accumulation slowly becomes neurotoxic, harming the nerves it protects. Seniors are more vulnerable since their livers clean poison slowly and their nerves are weaker. A 2017 neurology study found that older persons taking high-dose B6 supplements had twice the incidence of nerve injury symptoms, aging-like symptoms. Why most seniors miss the issue? The signs of B6 poisoning resemble normal aging or diabetes, foot and hand tingling, burning or numbness, falling frequently due to poor balance, weak muscles and weariness, aging like brain fog. The real culprit may not be age, it could be vitamin B6 poisoning. The dose trap. Vitamin B6's daily safe limit is 100 mg. This is the catch. Long-term 50 mg daily use can be harmful in elderly persons. One serving of several nerve support, formulations, and energy boosters contains 100 to 250% of the daily limit. With your daily multivitamin and fortified foods, you may be unknowingly overdosing every day. Nerve damage from too much B6 can take months or years to repair, unlike other deficiencies. Sometimes damage is permanent. What to do instead? Stick to food. Chickpeas, tuna, turkey, bananas, and fortified cereals offer enough B6 safely. Discover your everyday needs. Seniors need 1.5 mg for women and 1.7 mg for men. Check supplements. Change your multivitamin or nerve formula if it provides more than 5 to 10 mg of B6 per serving. Test before supplementing. Concerned? Get a B6 blood test from your doctor. Avoid large amounts just in case. Bottom line, vitamin B6 is okay, it's crucial. But too much can subtly impair movement, balance, and independence. After 60, nerves need just enough to stay healthy, not megadoses. Take a break from extra B6 for energy or nerve support, check your labels, and seek safer dietary sources. Because B6 is not better with more is risky. Danger to defense. The switch seniors must make. That's it. After 60, these 4 vitamins might weaken your body, inflame your organs, and destroy your nerves. However, this is encouraging. Avoiding danger is only half the battle. Living well after 60 requires more than cutting out the wrong supplements, fueling your body properly. True, some vitamins and nutrients help a lot. They can boost strength, heart health, memory, and lifespan. Instead of the dangerous ones we just covered, these next 4 are supported by the best senior health studies. One has been associated to a 36% lower all-cause mortality rate. Let's go from what you shouldn't take to what you need daily to be strong, steady, and sharp in your 70s, 80s, and beyond. First up is a mineral most seniors are deficient in, yet which powers over 300 physiological activities. Best vitamin number 4, magnesium. Post-60 mineral that quietly rebuilds. One nutrient most seniors silently lack is magnesium. And the tricky part, you may not realize it's lacking until your body sends symptoms you would mistake for aging. Think about it. Poor sleep, nighttime cramps, and weariness despite a steady heartbeat. Many elderly dismiss these as natural aging. These symptoms are typical of magnesium insufficiency, study reveals. The importance of magnesium after 60. Your body performs over 300 metabolic activities with magnesium. It regulates blood sugar and insulin sensitivity, strengthens bones with calcium and vitamin D, regulates heart rhythm, helps muscles contract and relax, and supports nerve and brain function. But here's the issue. Our bodies absorb less magnesium from meals as we age. Additionally, senior medications like blood pressure tablets, acid reflux treatments, and diuretics remove magnesium from the body. That means even if you eat well, your levels may be declining annually. Magnesium deficiency in older adults was linked to 50% higher risk of atrial fibrillation, an irregular heartbeat that increases stroke risk, dementia and memory loss, type 2 diabetes, and chronic inflammation, which accelerates aging, according to a 2018 study in Nutrients. No wonder experts call magnesium one of the most underappreciated minerals for seniors. Good news: how to get magnesium. Right restoring magnesium levels improves health. Correcting inadequacies helps seniors sleep better, have fewer muscle cramps and restless nights, improve memory and focus, more stable mood and energy, better balance, and fewer falls. This is the catch: not all magnesium supplements are alike. Magnesium oxide? Cheap yet ineffective and diarrheal. The best magnesium forms for seniors include glycinate, citrate, and malate. These absorb better and are easier on the stomach. Most seniors should take 250 to 400 milligrams per day, depending on diet and health. Foods that boost magnesium: leafy greens like spinach and kale, pumpkin seeds and almonds, avocados, black beans and lentils, and dark chocolate in moderation are magnesium-rich. However, soil depletion makes food alone insufficient. Therefore, clever supplementation can change your life. Magnesium is quiet but powerful for elders. Correct the deficiency and many age issues: cramping, bad sleep, and brain fog go. Next, the third best vitamin. Your skin can't make enough of it, and your bones, immunity, and mood suffer. Best vitamin number 3, vitamin D3, which resists weakness beyond 60. If magnesium is the silent helper, vitamin D3 is the master switch. Your bones, immune system, and brain depend on this substance. By 65, your body's vitamin D3 production reduces by over 50%. Why? Because your skin transforms sunshine into vitamin D less efficiently. Spending more time indoors, applying sunscreen, or living in northern latitudes with weaker sunshine nearly guarantees insufficiency. Why vitamin D3 matters beyond 60? Vitamin D3 helps prevent fractures, but it's more. It's more like a hormone that affects most body systems. Strengthens bones with calcium and vitamin K2 to prevent fractures. Deficient muscle protection causes weakness and falls. Immune defense fights pathogens and repairs damage. Brain health boosts mood, memory, and cognition. In 2020, the British Medical Journal showed that seniors with insufficient vitamin D had a 50% higher risk of respiratory infections and a 30% higher risk of all-cause death. Low vitamin D3 levels increase the risk of heart disease, diabetes, and dementia. Low vitamin D3 symptoms, the worrisome part. Most elders are unaware of their deficiencies. Symptoms are typically inconspicuous: chronic weariness, sadness, frequent colds or slow recovery, painful bones or weak muscles, poor balance, and increased falls. Sound familiar? Many elderly blame aging, although vitamin D3 deficiency is often to blame. Safe vitamin D3 restoration, the issue. Most multivitamins contain 400–800 IU of vitamin D3. However, older persons need 1,000 to 2,000 IU daily to maintain appropriate blood levels, according to studies. Cholecalciferol D3 is better than weaker, less bioavailable D2. Vitamin D3 should be taken with healthy fats like olive oil, avocado, or salmon. Fat-soluble, therefore absorption is greatly improved. Your doctor may temporarily increase doses to compensate low blood levels. Sunlight is vital, but diet can also provide vitamin D3. Fatty fish like salmon, mackerel, and sardines are good. Milk and orange juice fortified. This is the truth. Smart supplementation is often necessary beyond 60 because food alone isn't adequate. Vitamin D3 protects against aging. Bones, muscles, immunity, and brain functions suffer without it. It often makes elders healthier, more energetic, and happier within weeks. Next, the second best vitamin, one deficiency that can simulate dementia, deplete energy, and silently weaken legs if neglected. B12 is the second best vitamin for nerve and brain protection after 60. If vitamin D3 is your body's protection, vitamin B12 is its spark plug, keeping your nerves firing, blood flowing, and memory sharp. The frightening truth: 1 in 4 65-year-olds are B12 deficient, and most don't know it. Why? Because aging alters everything. The stomach produces less acid with age. Separating food from B12 requires that acid. The problem worsens when seniors take antacids, proton pump inhibitors, or metformin for reflux or diabetes. Even if you consume eggs, poultry, and dairy often, your body may not absorb enough B12 to keep healthy. Why is vitamin B12 crucial beyond 60? 3 key systems need vitamin B12: brain and memory. Guards nerve cells, inhibits brain shrinkage, and provides mental clarity. Blood health promotes red blood cell production, reducing tiredness and anemia. Balance and muscle maintains leg strength by supporting nerve-muscle connection. Deficiency causes more than fatigue. It can resemble dementia, sadness, or neuropathy. Many seniors are told it's just aging when it's a dietary issue. Vitamin B12 deficiency symptoms. Warning indicators often appear unexpectedly: constant weariness or weakness, brain fog, confusion or memory loss, numbness or tingling hands and feet, unsteadiness or falls, brittle nails or pale skin. Low B12 can harm nerves irreversibly if untreated. Testing and supplements are crucial after 60. Safe vitamin B12 restoration. Seniors need 500 to 1,000 micrograms per day, more than most multivitamins. How to do it right? Take the right form. Search for methylcobalamin or cyanocobalamin. Aged bodies absorb these types better. Select delivery. Sublingual lozenges dissolve under the tongue, avoid the stomach, and absorb into the circulation. Doctors may provide injections for severe deficit. Don't just eat. Fish, poultry, eggs, and dairy provide B12, but decreasing stomach acid makes absorption uncertain in older persons. The good news: water-soluble B12. Your body eliminates excess, therefore poisoning is unlikely. B12-rich foods. With strong digestion, these foods can boost your levels. Sardines, tuna, salmon, eggs, especially yolk, beef grass-fed, milk with yogurt. After 60, vitamins are often needed to stay healthy. First best vitamin: EPA and DHA omega-3s. Seniors must never overlook this lifespan nutrient. Omega-3s can influence your aging process. Not only are EPA and DHA healthy fats good for you, they prolong life. A huge European Journal of Clinical Nutrition study monitored over 42,000 elderly and revealed something amazing. High omega-3 blood levels reduced all-cause mortality by 36%. That implies fewer heart attacks, strokes, better minds, stronger joints, and longer lives. Why are omega-3s important beyond 60? Chronic inflammation becomes your silent enemy with age. It causes arthritis, muscle weakness, artery stiffness, and mental degeneration. Here come omega-3s: heart health. They lower harmful arrhythmias, lipids, and blood vessel stiffness. Brain function. DHA is brain tissue building material. It safeguards mood, focus, and memory. Protection of joints. Omega-3s relieve stiffness and soreness, making movement easier. Longevity. Omega-3s protect DNA telomeres, slowing cellular aging, according to multiple studies. Omega-3s do more than extend life. They improve longevity. Omega-3 deficiency. This is the catch. 68% of American seniors lack omega-3s. Why? Because most seniors don't eat enough fatty fish. Processed foods with omega-6 oils, corn, soy, and canola upset the equilibrium. Inflammation from that imbalance causes joint pain, brain confusion, heart disease, and quicker aging. Getting enough omega-3s after 60? Number 1, eat extra fatty fish. Try 2 to 3 meals of salmon, sardines, anchovies, or mackerel per week. Number 2, use supplements wisely. Choose a high-quality fish oil with 1,000 ml of EPA and DHA daily. For seniors with cardiac or inflammatory disorders, doctors may recommend 2,000 mg or more. Number 3, the label should list fish oil tested for heavy metals, refined for safety, and in triglyceride form for better absorption. Number 4, take it with meals, especially healthy fats like avocado or olive oil, to increase absorption. Number 5, alternatives from plants. Vegans and fish allergics can get DHA from algae-based omega-3 supplements. Omega-3 rich foods: salmon, sardines, mackerel, chia, flax, form, weaker yet useful, walnuts, pasture-raised eggs. Post-60, diet alone isn't enough for therapeutic levels. Supplements matter. The closest thing to nutritional insurance is omega-3s. They safeguard your brain, heart, joints, and independence as you age. Choose an omega-3 supplement for your regular routine after 60, not just living longer, to live stronger. The end. That's it. Truth about vitamins after 60. Retinol-based vitamin A, iron, calcium, and high-dose B6 can slowly accelerate aging, weaken the heart, and damage neurons. Senior labeling conceals these subtle threats. They may make you feel older than you are. However, choosing magnesium, vitamin D3, vitamin B12, and omega-3 fatty acids gives your body the support it needs at this stage of life. These nutrients boost energy, brain power, heart health, and bone density. Luck doesn't distinguish decline from vigor, not just age. The daily choices you make. Every medicine bite and habit weakens or strengthens you. It's better health wants you to remember, aging is inevitable, but suffering is optional. If today's video opened your eyes, keep going. Check supplement labels tonight. Consult your doctor about vitamin testing. Most importantly, switch from detrimental to helpful. You ride your future health with every choice since it's unwritten. Which vitamin surprised you most today? Was it your current medication? If you enjoyed this, subscribe, and turn on the notifications to never miss the health facts that keep you stronger, longer. Don't let your best years pass. The appropriate nourishment can keep them ahead.